Not controlled clinical trials, scientists say their findings are more open to interpretation. Channel 4 News and the BMJ asked Professor Nick Fremantle to examine a number of these studies. He believes the papers show that Tamiflu has some effect on complications in healthy people, but he has doubts about its overall value.
When we look at the studies, we find that in absolute terms, the treatment effects of Tamiflu are very small in patients with no other existing health conditions. There's really no evidence at all that anything very worthwhile is going on with the use of Tamiflu in otherwise healthy people.
You sold tens of millions of doses of this medicine to the British government for use as a pandemic drug. They're giving it to perfectly healthy people, in fact anybody who's perfectly healthy who goes down with swine flu or thinks they have symptoms of swine flu.
It can still provide benefit, clearly, and I think one of the things that and I want to make that point very clear, and that is that even in the otherwise healthy population, Tamiflu can provide a significant benefit in terms of reducing the duration and severity of influenza. For some, it's going to mean actually a reduction in the chance that they're going to get some of these severe complications.
It's ads like these which are driving thousands to the government flu lines to obtain Tamiflu. But what about the other claims made for the drug? Today's review concludes that for some people exposed to the flu virus, Tamiflu can reduce the chances of infection, and it accepts Tamiflu can reduce flu symptoms modestly. But as Dr. Jefferson points out, it may be that this second claim could be made for a couple of cheaper alternative drugs.
I think the obvious next step would be for governments who recommend the use of Tamiflu to organise a large, multi-centre, independent, publicly funded control trial testing Tamiflu against anti-inflammatory drugs such as aspirin or paracetamol, depending on age groups.
Roche said it felt that it would not be ethical to conduct such a study, but that control groups in previous trials were allowed to use paracetamol anyway, and those trials showed Tamiflu to be effective. So given its common side effects like nausea, is handing out Tamiflu to otherwise healthy people the most sensible option for public health?
I see very little evidence to support the widespread use of Tamiflu in the otherwise healthy population who are developing signs of influenza-like illness. Very little evidence to support that. But I suppose once you've gone and bought lots of doses, then it's a bit like the situation with gun control in the US. If you have a loaded gun in the house, it's much easier to use it, but it doesn't mean it's the right thing to do.
In a statement, the Department of Health told Channel 4 News,
"Unlike seasonal flu, swine flu has caused high levels of severe illness in the young and healthy, and in some cases death. So it's difficult to determine who will be hardest hit. Our priority has always been to minimise the risk of serious illness and death from swine flu. Therefore, our strategy remains to offer antivirals to all patients with the illness."
They also pointed to observational studies which they felt supported Tamiflu's role in reducing complications. An editorial in the BMJ this evening says that when vast quantities of public money and large amounts of public trust are placed in drugs, the full data must be made accessible to the scientific community. The experience of independent scientists scrutinising Tamiflu doesn't just raise questions about that drug, but about the entire system that evaluates, regulates and promotes the medicines we buy.
That exclusive report from Tom Clark. And